Assalamu alaikum wa rahmatullahi wa barakatuh. Ahlan wa sahlan wa marhaba. A warm welcome to Muslima Insight. Today in Muslima Insight, we are going to take a closer look at anxiety disorders, some of its clinical features, its signs and symptoms, as well as treatment available for those who suffer with anxiety. And with me in studio to share with us their knowledge and wisdom on this topic, we've got the lovely Fatima Adam, who is an educational psychologist that especially also deals with anxiety in children. Assalamu alaikum and welcome.
Wa alaikum salam. Jazakallah for having me here.
Thank you so much. And of course, our regular guest on the show, Dr. Nazmira Kamisa, integrative psychiatrist. Assalamu alaikum and welcome.
Wa alaikum salam. Thank you, Adila. It's great to be here again.
When we come to anxiety, let us start off perhaps at the most simplest place and explain to our viewers the difference between anxiety as opposed to being fearful.
So if we look at fear, fear is related to current situation that an individual would be in. So if a person is fearful of something that to now, which is real, appropriate, and probably a logical response to what is happening, it is a natural emotion, and it does serve a purpose. So it is a warning signal, which can serve as a protective mechanism when it comes to human development and evolution and safety behaviors. Anxiety, on the other hand, tends to be something which is a fear of something in the future usually. So it is something that could possibly happen. It's often irrational or out of proportion. Some anxiety is natural. So they do say that small amounts of anxiety are protective because they act also as a warning signal. And for example, if somebody's going to be writing an exam, they will feel anxious, and that anxiety should then sort of initiate steps for them to take in order to be prepared for that examination, for example. Anxiety can at other times become irrational, and that is when it becomes an anxiety disorder, which is something which then has an impact on an individual's life and affects their functioning.
And Sister Fatima, from your side, in relation to this definition?
I think the important thing to understand when you're trying to draw the line for the layman is when do I know that this anxiety becomes a problem? It's when it affects your normal functioning, when it impacts on your sleeping patterns, your eating habits, when you can't function as you normally do because you are stuck in this state of fear, worry, nervousness. So anxiety is sort of an umbrella term of emotions like fear, nervousness, restlessness, all of that encapsulated. And when it impacts on your daily functioning, then it becomes a disorder. And as my Dr. Nazmira has mentioned here, that it's normal to have a little dose of it, because that's our body's way of saying, be aware, be alert, prepare yourself. That's our body's way of alerting us. But when it goes into overdrive and it can't come back down to that level, that normal level, it becomes a problem then.
And then if we look at anxiety disorders, obviously you've got your major anxiety disorders. Can we go through the clinical features of some of them that I've got on my list? Let's perhaps start with having a specific phobia. What are some of the clinical features relating to that?
So a specific phobia relates to anxiety and fear surrounding something specific. For example, somebody who is afraid of heights and becomes extremely anxious would have intense fear, worry, tension, as well as accompanying physical symptoms of anxiety like muscle tension, like sweating, for example, or feeling out of breath, short of breath, difficulty breathing, as well as avoidance of that situation. So avoidance is a key thing when it comes to most anxiety disorders. In the case of phobias, they are quite specific to certain situations rather than generalized to anything. So you have quite a variety of phobias, like, blood phobias or phobias of injections. People being afraid of, like we said, heights, which is quite a common phobia. And when exposed to that situation, the person will experience intense anxiety, which is often disabling.
Absolutely.
And I think also, you know, it's that with a phobia, it's a specific fear of a specific something. So I could have a phobia, a fear for spiders, and it becomes a phobia. And like you said, it's an avoidance. So I avoid any situation where I think I might be exposed to a spider, for example. So the intensity of the phobia can be so bad that people wouldn't even look at pictures. So you get people that would say, if I'm going to the library or the bookshop, I don't go to that section because there's books on spiders, and I can't bear. It's at the point of realizing that I might be exposed to that spider or that particular phobia, that the nervousness, everything starts building up, sweaty palms, you know, watery eyes, all the physiological actions related to that anxiety start building up. So it's a specific fear of a specific something, although people can have more than one phobia. So you know, you can't only have just one. So you might have people that have a phobia of spiders, and then they have a phobia of heights, or they have the most common one. A lot of people, you'll hear them saying in a lift in a building is, I have claustrophobia, I can't breathe in here, I'm feeling like I can't breathe. So that's, you know, that's a fear of crowds and feeling enclosed and encapsulated. So you have a variety of fears. And again, how do you know when it's a phobia? It's when it affects your daily functioning, when you doing that avoidance, you know, that even if you take your kids to the zoo as an adult, you say, oh, I'm not going to the reptile park, I can't bear to see the snakes there. Just it stops your life.
So what would you say in that moment to assist a person that is suffering with a phobia, let's say of snakes? That person, what is the emotion that almost triggers? Is it built in? Are we born with these certain phobias that we can't stand, or is it that intense fear? What emotion exactly triggers that person to go into that state of panic and anxiety?
Firstly, these like phobias, and it could stem from experiences. So a human being can have a bad experience. For example, you can have a bad experience with a snake, you know, and that can traumatize you and create that phobia. And then on other times, it's maybe not just a personal experience, but as a young person, as a child, you told these horrid stories about things, and you know, and that builds in your imagination, and you develop, and as you're growing, you still have that phobia and that fear of addressing it. But like a fear of heights, somebody might be standing and say, oh, I can fall, and they just that natural sense of fear builds up, but it heightens up more than the normal person, and then that becomes a phobia. So it's experiences, it's your social context and how you perceive what's going on, along with your natural tendencies of the natural elements of fear that we have.
That we should have. Nazmira, from your side?
I must agree that, you know, what the sister has said, you know, life experiences do contribute to the development of phobias. And then we've got to look at genetic factors as well. So some people are more predisposed to developing anxiety disorders in general, and phobias would be a specific anxiety disorder. They say that children of parents who have anxiety disorders have 6 times the risk. So they have a 6 times higher rate of anxiety disorders in children of adults with anxiety disorders. So something that we need to look at is genetic risk, and then also modeling. Because children will model their parents. We know this. And we know this in all things, that they will not do what we tell them to do, they will do what we do. And that not only applies to our behavior, but it applies to also our emotional states and our emotional behaviors and our reactions to things. And we know that anxiety disorders are based on fear, when fear becomes irrational. So that is the core emotion, and they will watch us and model our behavior. So that, combined with the genetic risk, you know, that they carry in their genes, will probably, you know, both be contributing. So if we're looking at, you know, something else called epigenetics, so there's a new field now called epigenetics, where we look at not only the genes that we carry, so not only the genes that child will carry, which will increase their risk of developing an anxiety disorder, for example, a phobia, but their environment, and how their environment and the emotions that they experience and the energy that creates impacts on their genes. So that can then alter genes, that can cause certain genes to be expressed and others to be switched on, others off. So your environment as well as your genes will contribute to the development of these anxiety disorders.
And obviously, excuse me, and in listening to what you're saying, I think also, especially in children, the not knowing what I don't know. That just looking at mom or dad and the reaction they're having and the information that is not there adds to that anxiety. And it's very interesting about the genes that needs, obviously, that environment then to trigger that.
Yes. Just show it, and that is proof that we are not victims of our genes. So we are not doomed because of our genes. Our environment and nurturing and parenting can affect it, can prevent the expression of certain genetic conditions and can trigger them.
Absolutely. On that note, it is time for us to go to an ad break. Stay tuned. Assalamu alaikum wa rahmatullahi wa barakatuh. A warm welcome back to Muslima Insight. Dr. Nazmira, before the break, we were discussing how genes and the environment can trigger this type of anxiety, specific anxiety within children and phobias. And I also mentioned that for a child, for example, not knowing sufficient information can of course lead to that, but also giving too much information can also trigger that. Can you elaborate for us on that?
Absolutely. You know, there was an article that I read about anxiety in children, and us, because living in a country like this, we want to prepare our children and we want to warn them of danger. And what they said was that your response or your reaction to certain things, for example, telling your kids about burglars or about hijacking, and your safety behaviors related to that, is often enough. And just informing them that you are doing this just to keep safe is often enough. We often tend to, or people tend to want to warn our children, so we tell them too much. And telling your children, as well as exposing them to your response and your reaction, can often develop anxiety disorders in children.
I think it's also a provision of age-appropriate information.
Yes.
It depends on the age of the child. So, and the frequency and it's a number of factors. It's how I say it, what I say, when I say it, what is my body language also communicating, and then my daily behavior in response to that. So if I keep going, lock your doors, don't look outside the window, we're driving past, and then that obviously would then condition this child to start being anxious, because it's exactly what our sister's saying here. But it's also age appropriate. So if you've got a teenager, you build on that information and you explain responsibility and you explain safety on a much higher level. But if you've got a 5-year-old or a 3-year-old, you don't say you say, look, we need to keep ourselves safe, so we lock our doors at night and we switch on the alarm or whatever. That's enough information. So adults also need to gauge their behavior, their choice of words, the subtle body language, all of that compounded communicates to the younger people about how to deal with phobias and anxiety.
Because actions really speak louder than words, and it's about, I think, 53 or 58% of your body language is communication. Moving on to the next type of anxiety disorder is social phobias. What can you tell us about social phobias?
So social phobia or social anxiety disorder specifically refers to severe anxiety which people experience in public or in social situations or in company of other people. It tends to involve a fear of embarrassment or humiliation in front of other people, and this can sometimes be in the context of public speaking, for example. Or it can even be in social interaction. So just, for example, going to the mall or being surrounded by people. And then when it reaches sort of an intense level, it's the fear of crowds. People often become very anxious and sometimes, will avoid, again, groups of people, going out, public speaking, situations at work, meetings where they feel that they're on the spot and then people will look at them, possibly ridicule them or humiliate them. And then when this reaches an intense level where we then describe it as a disorder, again, like the sister said, is when it impacts on people's functioning. So it is natural for us to be anxious in those situations. Somebody who has to give a speech at school or is going up onto a stage and speaking in public who feels anxious does not have social anxiety disorder, because it's a natural response to that situation. It is when they begin to avoid it, when it has severe consequences and impacts on their functioning, when they refuse to do it or are unable to complete tasks or function, is when we then describe it as a disorder, which will then require some kind of intervention.
And in your experience?
I think an important point also to distinguish is when a person's an introvert and when they have a social phobia. Because you get introverted personalities where they tend to prefer to be on their own or with small groups of people, and or tend to just they're happy being on their own and doing things, and they don't need stimulation from people and that. So there needs to be a distinguishing factor between that. So if somebody chooses to be alone, it's not that they have a social phobia, it's that they're quite contented and calm and happy to be on their own. But when they need to be in a crowd, they don't experience intense anxiety or fear of the crowds. They can actually do it, but it's just not their preference.
Yes.
So with social phobia, and that, people tend to not see the boundary there, the line there, and personality choices. So an extrovert would be somebody who's just stimulates and gets energized by people and enjoys, and an introvert is not. And the social phobia comes in when that anxiety kicks into uncontrollable heights. And as Sister Nazmira said, you always will have a level of anxiety. That's your body's natural way of giving you warning signs. But when you feel overwhelmed, you can't breathe, you feel stifled, then you know you have a social phobia.
Absolutely. And would you also say, for like you've mentioned about people that are introverted, that prefer to stay at home, etc., is sometimes misread as a person that stays indoors because they are fearful of going outside. How can that person cope better in the sense of in their ecology with people around them, to make them understand that it is not necessarily a phobia, but it is simply that person's preference?
I think again it goes to the point that if I had to extend an invitation to an introvert to attend a social gathering, their response immediately would be indicative. So, well, it's not my first choice of wanting to be with people, but I'm happy to be there, to conform to the requirements of the gathering. I don't have. But a person with a social phobia is going to go, I can't do this. This is unbearable. And it's just not going to happen. You see, the responses that you're going to get is going to be immediately indicative of who's got the phobia, who's got... An introverted person does not have a social phobia. It's just their
So the reaction
preference.
won't be as intense. And then coming also to assisting the person with a social phobia, what steps are there that therapists and also, again, the people in the ecology present in that person's life that they can do to help that person?
If we're looking at therapy, for example, there is cognitive behavioral therapy, which then works on the thoughts as well as the behaviors related to that specific anxiety disorder. So it would involve helping the person to understand where this fear came from, because there's usually a process that goes back to their early years. So if you look back at a specific individual with, for example, the social anxiety disorder or the social phobia, there would have been an initial triggering event, and prior to that there would have been some kind of a belief system that they would have developed. So for example, if I go out and speak in public, then people will look at me and laugh at me. And then it probably was confirmed. There would have been an event when maybe they did that, and maybe people smiled, or people had their own conversation, or maybe somebody did laugh. And that would have confirmed that belief. And once you have that, people then believe that that is evidence for that negative automatic thought.
Sure.
So that then becomes an automatic thought which circulates in their mind or in their brain, and that then determines their behavior. And with that we get the eliciting of the physical symptoms, so this restlessness or the trembling, the sweaty palms, and that then becomes quite disabling when you combine the thoughts with those physical manifestations. What you would do in cognitive behavioral therapy is look at the thoughts and look at the behaviors. So attacking or addressing the negative automatic thoughts using thoughts stopping. So identifying those thoughts and replacing them with positive thoughts. Other strategies that psychologists can use are systematic desensitization. So that means slowly and systematically developing a list of situations which are anxiety provoking, from the most anxiety provoking to the least. So if you're looking at which is the worst situation for that particular individual, going down to the least, for example, maybe just going out to the shops and having a conversation with somebody there, and then systematically going through those with behavioral experiments. So in other words, if you were an individual like that, you would make that list and then you would start. And often, like you said, the ecology, so the environment, the family or the spouse need to be part of that, because then that individual needs support. So maybe the husband or the sister or somebody accompanying that person to the shops or to an environment where they have a feared situation, and then being exposed to that, as well as at the same time being reassured that things will be okay. And then we often combine that with breathing exercises, because in anxiety they say we stop breathing. We don't realize it, but we are not taking in enough oxygen.
Absolutely.
And then that obviously compounds the anxiety. And then there are other situations where we have hyperventilation and anxiety, so our breathing is important. And then mental exercises, so refocusing, or choosing an object or something to focus on that will occupy you, whether it's watching people walk by or studying something or reading something, just to occupy yourself, or even counting something. And I don't want to say that, because then that will lead us to the OCD type of spectrum, where people do things like counting in excess, irrationally, compulsively. This is different. So this is about distracting yourself from that anxiety.
And it makes sense, because I know also for us as coach practitioners or life coaches, we use a tool called collapsing anchors, to go back to identifying what anchor was set perhaps in the past, and now every time when the person is exposed, it triggers the same anchor, and we call the tool collapsing of anchors. And it's to identify and slowly work towards collapsing that initial sensitizing event. On that note, it is time for us once again to go to an ad break. Stay tuned. Assalamu alaikum wa rahmatullahi wa barakatuh. A warm welcome back to Muslima Insight. Sisters, just to go back a little bit to what we discussed before the break, what can the people that are within the environment of an anxiety sufferer do to assist, to make it better for that person?
I think the first and foremost point to understand is, when a person has an anxiety attack or a panic, and they are not rational. They are very irrational. And so to pose a point of logic to that person at that point it's of no use, because no matter what you're saying, they are not listening to you, because they are it's almost like you're getting this override of emotion and tenseness, and your senses are not functioning. You're not hearing. You can hear voices, but you're not perceiving.
And your focus is clearly somewhere else.
Exactly. So don't, as a family member, supporting family member, don't try to as the point of reason. The most important thing to understand is, at that point, is to help that person to calm down. So if it is, for example, at that point, I'm afraid that there's a spider coming through the doorway, then as a supporting family member, what would I do? I'd shut the doorway. Or I'd say, okay, you know what, let's go away from here. Let's go to the other room and close the door. Or let's get into the car and take a drive. Would that make you feel calmer? Do you need a glass of water? You do it on a physical level to calm that person down. Because there's a lot of physiological things that are going on in the body. And that sight of what could be, remember, it might not necessarily be a reality that there is a snake or whatever coming through the door. It's an anxiety. So it's, so you need to change that scene for that person. So assist them by helping them to calm down, number one. Number two, avoid ridicule. Don't use comments like, don't be ridiculous, where do you see it? I don't see anything. Avoid name calling. Don't be stupid. Even with young people, because then those labels latch on. And then that becomes a whole bigger problem. So avoid that. Yes, it's very difficult for people to live with people who have anxiety, panic disorders, and that. It is. It's not easy because they release this intense energy that can drain you when you're trying to help them. You actually feel exhausted when you help someone and get through an attack.
Correct.
So if it becomes too much for an individual, take time out. If you need to leave the room or if you need to just calm down yourself, take that time out. That person will, that anxiety is going to continue. You take time out, calm yourself down, bring yourself to that point of, you know what, this person is not rational right now and I need to calm down. And then go back to that person and assist them. But avoid that verbal struggle, because the more you're going to get into it, you're not going to get much out of that person at that point.
Yeah, because exactly what you said, that person isn't rational right now. Their focus is somewhere else. They're not even really hearing what you are saying.
Yes.
So the first call of action, is like you've rightfully said, is to bring yourself to a place of calmness.
Yes.
And then bring that person also to a place of calmness before you try to rationalize and explain or talk the person through that. Moving a little bit further to panic disorders, what are some of the biological components that happens when a person now is experiencing a panic attack?
So physiologically, anxiety disorders are characterized by high levels of cortisol, which is a stress hormone. It is also, like we said, fear. So fear is the core emotion which leads to anxiety. So it's usually irrational fear, excessive fear, and fear that is out of proportion to what is actually happening. And in that case, we would get something like the fight or flight reaction. So developmentally and evolutionary, this is how human beings have survived. We have survived using this fight or flight response, which is an innate response that we have in our body, if we are faced with danger. So if you were possibly years ago faced with possibly a lion in front of you, you would need to make a decision, and this is often a reflex. So it would be to fight or to flight. In that case, flight would be the logical response, so you would run or escape in some way. Anxiety produces that on a physiological level with your hormones or your neurochemicals in your brain, like adrenaline and noradrenaline, cortisol levels. So these tend to be elevated in these situations of anxiety, and then when it comes to panic specifically, it is much more intense. Panic is a discrete episode. So a panic attack is described as a discrete episode of intense fear, anxiety and terror, and feeling panicky. So it usually can last up to a few hours, but they say that it usually lasts about 10 minutes. So it reaches a peak within 10 minutes of intensity, during which time people experience these symptoms of possibly feeling short of breath, not being able to breathe. Sometimes they have chest pain, they have sweaty palms, shaking and trembling, feeling restless, and it is extremely intense. So this, accompanied with the psychological aspect of it, which would be thoughts or fear of, going mad, or a fear that the person is about to die. And this is why people with panic attacks often have lots of visits to A&E or casualty, because they really do believe that they're having a heart attack or that they are about to die, or that something bad is about to happen. And that is why they often, you find them going to hospital, to casualties, and family members will take them there because of the intensity of this response and reaction, which they then see externally as well, because of the physiological response that accompanies it. They have ECGs done, and often these are all negative. And that is usually how panic disorder comes into the realm of the psychiatrist. So people will refer them and say, this person has been having regular attacks, unexpected, not precipitated by anything, out of the blue, and there is nothing physically wrong that we can detect. And that is often how we diagnose a panic disorder.
And would you say that, let's say for a person that has been in a smash and grab or a hijacking, that that particular trigger can happen months, maybe later, where they would find themselves driving and suddenly those emotions would be triggered?
Absolutely. People who have had trauma or have had a panic attack during driving may then avoid driving. If somebody's been in a smash and grab, for example, this could potentially be related to panic disorder, but it can also then be a post-traumatic stress disorder.
Yes.
Because we do then have a triggering event and a traumatic event where the person then was faced with something, a danger, potential harm, threat of harm to themselves or to somebody else, and then later on experiencing that could be then a flashback, for example, or a reliving experience, and then accompanied with avoidance of that situation. For example, if it was driving in this case, it could potentially be a post-traumatic stress disorder.
Yes, yes. So obviously, would you say that best is when a person has been exposed to a traumatic situation, it's vitally important to deal with what happened so that this post-traumatic stress disorder doesn't set in at a later stage?
Absolutely. And look, we know now, okay, with the latest research and findings, that debriefing shouldn't happen immediately. So in other words, you should not force or encourage a person to talk about a trauma or a traumatic event like that immediately, and at least not within the first few days. So after the first few days, say 2 or 3 days, then you can begin counseling them and discussing the event and their response and their reaction and their safety behaviors. But unless somebody wants to discuss it before that, it can actually precipitate PTSD or post-traumatic stress disorder if you do that in advance. But counseling and supportive therapy, is a necessary thing, even if it's just to monitor that person's progress and support them.
But we also wouldn't leave it out completely.
Yes, absolutely. They say that, don't do it within the first 3 days, especially not within the first 24 hours. But after that, it is a vital part of preventing the development of post-traumatic disorder. So it's just about fine-tuning and getting that balance just right.
And I think an important thing when people experience post-traumatic stress disorder and traumatic events is if they want to be okay. They want things to go back to normal as soon as possible. So when you say, I think you need to go for counseling right now, it's, no, I'm fine. So again, you've got to just let them be, let everything sort of just settle down in that, because that they're still going through all of that. And as a human being, you just desperately want to be okay. All of us just want to be okay. So when you got to go for counseling. That person then starts experiencing, when they left alone, those thoughts start manifesting, those issues start manifesting, and then they gradually, when you give them that space, and you don't say, oh, now tell me what happened on the day, or you kind of just give them that space. They might not want to talk about on the day. They might want to talk about their thoughts that have occurred after that. So you give them that space to let them take it from the angle they want to, because that person has experienced it, not you. Exactly. You're the supportive mechanism there.
And it's really to have effective listening skills, to talk less and listen more, and to wait for the opportunity when that person is ready. When they want to talk, they'll open up, and not to keep fiddling with that, because like Dr. Nazmira said, you can be triggering a post-traumatic stress disorder or something much worse. Again, it's time for us to go to an ad break. Stay tuned. Assalamu alaikum wa rahmatullahi wa barakatuh. A warm welcome back to Muslima Insight. When we move a little bit further to generalized anxiety disorders, what can you tell us about that?
Generalized anxiety disorder is a very common anxiety disorder, most common in females, and it refers to non-specific, generalized anxiety about anything. So it is not like specific to a certain thing, like we talked about specific phobias, where it's related to heights or snakes or the spiders. This is generalized anxiety about anything and everything on a daily basis. It's constant, it's irrational, it's persistent, and it's completely out of proportion to what is happening in the individual's life. So it takes up a lot of time, it takes up a lot of energy, and with that you get the physical symptoms of restlessness, fatigue, sleeplessness, irritability, because the person's body and physiological system is in a constant state of hyperarousal, which means that they are constantly on the lookout for fear. So if we look at the fight or flight response, it is someone who is on some level in a constant state of fear. And therefore their body will reflect that with those physical symptoms, and their mind will reflect that with a constant worry over things.
Is there a specific issues or specific examples that you can give us for our viewers to better understand what exactly is a generalized anxiety disorder? Is there specific things that they worry about, or is it in general about life in general?
It's as the terminology says, it's general. So, for example, if my child comes to me and says, oh, tomorrow I have a sports day and I'm going to stand at the top field and jump down. And if I have generalizing, oh, he's going to jump down. What if he falls? What if he breaks his leg? What if I don't see him again? And then the worry, it's just, you know, out of really nothing. Or, for example, you say, oh, we have guests over. I hope the food's okay. I'm so worried. I hope there's enough. Like anything and everything becomes this excuse to engage in that level of stressing and being anxious and panicking and all of that. So it can be anything, you know. It can be just a stranger approaching you and you think, oh, why didn't they smile at me? Oh, there must be something. And one thought leads to another thought and goes into the cycle, that negative cycle. So it can be anything.
So would that person then constantly be, one would say, on that constant worrying and being anxious about every little thing that comes up continuously?
Yes. So in order for it to be a generalized anxiety disorder, it must impact their functioning. Because if I have guests over, sometimes I do worry that things will go well, or that, you know, the food will taste good, or that there'll be enough salt or whatever. But if it becomes persistent, irrational, excessive, and it starts to affect your functioning, so now you're preparing for this meal or this dinner, and it takes you 2 or 3 days. And you keep changing things, and you have to maybe get rid of something and redo it, when actually there's probably nothing wrong with it. Or other people around you, you know, find this irrational, or your husband or somebody tastes it and says, it's fine, yet you are firm and fixed in that belief that there is something seriously wrong and that you have to keep doing it. So now this is an impact on your functioning. Okay?
Absolutely.
So the minute it begins to do that, so it's got to be intense, out of proportion and severe
and
in order to be...
Yes.
And persistent and continuous in order for it to be specifically diagnosed as a generalized anxiety disorder.
And it can be, it's not only debilitating for the person experiencing it, but if you think of a mother with children, you know, and now your child comes home and says, oh, I'm going to do a high jump at school at the sports event, and then you go, I'm telling you, you can't go. So what happens is the repercussions of that then eventually is that it impacts on your children, because they don't get opportunities because of your anxiety related to that. They get held back.
Absolutely. And I think it's very much that our parents also must take cognizance of what we said in the beginning of the program, is sometimes your fears, if it's too excessive, it affects the ecology all around you.
Yes. Absolutely.
And coming to another phobia that we have is agoraphobia. Can you share with us the details about that?
So agoraphobia is often linked with panic disorder. It is the fear of going out. Often, you know, people describe it as the fear of going out of the house. Actually, it is a fear of an inability to escape. So being in a situation where escape may be difficult and you may be trapped in a situation. Often people who have panic attacks are afraid of that. Because they have had panic attacks, they're constantly preoccupied with having another panic attack. So then they develop these safety behaviors and these avoidance behaviors. So they will often avoid going out because of fear of having another panic attack. Because maybe being somewhere where it would be difficult to get away or to get home or to escape. People like that will engage in certain behaviors like sitting close to a door or somewhere where they can get out, like being close to an exit. And in severe cases, you know, they won't go out. They won't leave home. Just in order to avoid anxiety or panic.
Do you come across teens or children having this type of anxiety?
Yes, especially with teens, because of that fear of being judged when I leave, and what if they don't let me go, and how will I get out of there? Or if I go to school, I can't get out. You know, I'm stuck in that situation. So you do have it. But teenagers, you know, it manifests with so many other things. So it's not so easily to identify that it's agoraphobia. Because you would look at it and you say, okay, there are multiple other factors. But it is prevalent in younger people as well. It's just that the way you look at it with, you know, with an adult in the way they describe it, it might be, you know, a bit easier to see than with younger people, because younger people, there's so many other factors you've got to look at. It's the social, the peer pressure, and it's also that fear of just being judged. So, you know, and the criticism and what would people think, and young people also don't have, like the little ones also don't have the language skills to be able to express all of that. So you find it more in behavioral problems then, you know, where they start having behavioral problems and can often get misdiagnosed.
And again, I think it's not being aware as parents, what are the signs, what are the symptoms. Is a child just throwing a tantrum because he doesn't want to go out, or is there something underlying that we are missing? And then also very quickly, if we can look at some of comorbidity, the co-occurrence of phobias, how does that happen and what are the effects of that?
So looking at the comorbid conditions with anxiety, depression is the biggest one. So depression is comorbid, or in other words, co-occurs or exists together with anxiety disorders in general, most commonly. Especially anxiety disorder like generalized anxiety, post-traumatic stress disorder has a large comorbidity with depression. And, it's hard to say which comes first, because, you can be depressed and then develop certain phobias or fears or anxieties about things because you are then vulnerable. And a lot of people who do have anxiety disorders do become depressed because of the intensity of this fear and the difficulties that they face in their daily life, because it's an overwhelming thing to be able to have to live with and to have to overcome and still continue to live. If you are so afraid and so worried about the worst happening, it can be a really difficult thing for that individual to still live and carry out their daily life and their daily activities.
It's like they're totally consumed by that particular issue and they can't step out of that, like you've alluded to leading a normal life. In your experience?
It also becomes very lonely when you have anxiety. It becomes very lonely, because what happens is, like you said, you get stuck in that cycle of that fear or whatever it is, and you kind of lose touch with reality and with the people around you, because you're so consumed by what's going on with you, that you lose touch with your social circle, with family or whatever, and it becomes lonely. And very often people, you feel like, I'm the only one going through this, so you tend to go deeper inside. And then, you go into that cycle, and so it becomes, and that is where that depression sort of brews as well, and you become depressed and you're alone. And I think people need to understand that if you're feeling that way, that you're not alone.
Very important.
That's a very important point. You're not alone. A lot of people think, I don't tell anyone, no one will know, especially if it's with anxiety and all these disorders, fear of being labeled, and stigmatized and all of that. But you're not alone. There are a large number of people who go through this. And it's really, you deserve as an individual to live a healthy, happy life. And if something impairs on your functioning in that, don't be embarrassed to ask for help. Because once you have extreme anxiety and extreme depression, it's really, really a severe condition. And then we have large numbers of treatment factors, ranging from medication to all forms of therapy and all of that. But people shouldn't feel that they're alone. That is the big point.
Absolutely. I always say to my own clients is that Allah subhanahu wa ta'ala in His wisdom didn't make us into islands. He made us into families and into communities, and together we really can help each other, and that we are not alone. You are never ever alone. Some closing statements, Dr. Nazmira?
I think I have to second exactly what the sister said, that there is professional help out there, and like we discussed earlier, for families and in the environment supporting that individual, there's help for you, and for the individual suffering from anxiety, there is help. There are treatments. It doesn't mean that you will be on medication lifelong if you are not into medication, because that is, I find, often a treatment barrier. People don't want to take drugs. They don't want to be on medication, or there is this idea that they will become dependent or addicted to it, and it is not necessarily the case. Psychological therapies have shown a lot of benefit. There's a lot of research and evidence to back up the evidence base for effectiveness for psychological therapies in anxiety disorders. So you can, there's a lot of hope.
And from you, sister?
I think the most important thing that I'd like everyone to understand is that having an anxiety disorder or depression is the equivalent of having a physiological illness. We need to understand that. And it requires the same amount of attention as if you had a cardiac problem. You'd go to a cardiologist and you get all the help and all the support from your family. So therefore, having anxiety or depression and any of the phobias that we speak about is as intense as having those kind of illnesses, and it requires the same amount of attention and support,
Yes.
and that that there's hope.
I thank you once again for joining me here today. Do look out for our continuation on anxiety disorders, where we will in particular look at OCDs, as well as how gender and culture, there are different influences, as well as some guidances from our Quran and our Sunnah, how better to deal with anxiety as well as depression. From myself, Adila, Assalamu alaikum wa rahmatullahi wa barakatuh.